Hi, I'm Addie. I'm the PA student, and I want to talk to you a few minutes about colon cancer screening. I know that you're age 50 now, which is the recommended age to start undergoing this screening, even if you feel healthy and don't currently have any symptoms. Colon cancer is one of the leading causes of cancer-related deaths. However, it is extremely preventable with early screening tools. I will say I understand that you're not super open to the colonoscopy. It's a common concern. Both the preparation and the procedure are invasive and uncomfortable and can be a hassle to undergo. However, I will say that it is extremely safe. It's something that we do often, and it is our really only complete way to look for colon cancer. What it allows us to do is look at the entire colon in real time and not only identify current cancerous lesions that we can take care of while we're in there, but also new small growths called polyps, which can later develop into cancer. And so if we can go ahead and identify those and remove those, it can prevent a cancer diagnosis down the road, which is obviously the goal of these screenings. Even if you still have reservations, I understand there are other options which would consist of at-home, less invasive stool test, in which you would take a sample of your own stool and send it off to a lab. One of these is called a FIT test, which stands for a fecal immunochemical test. It's done every year, and what the lab is looking for is traces of blood in your stool, which can be an early sign of colon cancer. The other one is called a Cologuard test, which is done every 3 years. Also looks at your stool, and what that one looks for is early changes of DNA that's abnormal, as well as early traces of blood, which can indicate colon cancer. And so I will say those are both really good initial screenings. However, neither of them are meant to completely replace the colonoscopy as a whole. So in the event that either of those come back positive, the next step would be for you to undergo a colonoscopy to try to identify any current lesions in there that would cause those results to be positive. I will say, with you having no risk factors and being 50 years old, I feel comfortable with you starting with the at-home test if that makes you most comfortable. My goal is to make sure that we figure out what would be the best option for you and how I can support you in maintaining good health over the next few years. The risk of not going any screening is going to be you do develop a colon cancer that we miss until it's more advanced at a later stage, and obviously causing a worse prognosis at that point and making it harder to treat, which is something we want to avoid. So I'll give you time if you want to do some research on any of those options, or if you already know, you can let me know and I can help you take next steps in getting that scheduled.